And come August of 2019, August 31st, I went and I took my NCLEX PN exam. And by the grace of God and Real Mar, I am now a Real Mars nurse, and I am now licensed practical nurse Shakia Nishante McAllister. Like, this program helped me to answer all of my select all that apply questions, right? Everything is so detailed in its simplest form. And it really, really helps you and give you an understanding. So I recommend anyone go get the Real Mar review. Go get it, make the investment. I am telling you, through God and through Regina and Real Mar, you can and will be a nurse. So I thank you, God, and I thank you, Real Mar. I am now a licensed practical nurse and a Real Mar nurse. Go get that review, trust in God, and I'm telling you, you will succeed.
I love her testimony. I love her testimony for 3 reasons. Number one is because it shows that the struggle is real. She says she struggled to get into nursing school. How many of you guys are in nursing school right now? In nursing school. In nursing school. All right. Who's trying to get in? Who's just trying to get in, right? So she struggled for years to get into school. There's certain criteria that you have to reach, certain standards that you have to get to. And so she struggled to get in. Once she got in, she struggled some more. How many of you can relate? I don't. Anybody say? All right. She struggled to get in, struggled during school, tested several times, used different resources. I mean, how many of you guys are repeat testers? There's no shame right here. Okay. Repeat. Anybody here take it more than twice? Two? All right, we got 3. 3, can we get a 4? We can get a 5. 5 going once, going twice, 6. Can we got a 6? We got a 7. You just gonna keep your hand up, huh? You ain't gonna put it down. Yeah, how many times? 8 times. 8 times. Somebody watching here has taken this test 8 times, 10 times. Okay. All right. Well, listen, so we got 8, we got 10. Anybody more than 10? The good news in the room is this: that doesn't scare us. My name is Mark Callie, and I'm the president of Remar Review. I have the honor of, I'm not a nurse, so please don't ask me any nursing related questions. Okay. I'm not a nurse, but I did have enough sense to marry one, right? That's right. But we're not afraid of 8 and 10 times. Success stories that have taken the test up to 19 times before finding Remar Review. We have success stories of people that have been out of school before NCLEX was created. We had a nurse in California. She was an LVN. She graduated in 1966. She moved from California to Arizona. She wanted to take her position, her job title, her LPN or LVN license with her. She goes to the other state and they say, listen, you haven't taken NCLEX because it didn't exist at the time. She had been out of school 42 years, got the program, was able to do it, right? And so this is some amazing stuff. We have an amazing program here for you today. But the main message we want to let you know is that when you have the right help, you have the right resources and the right mindset, that with God, it's possible. Do you guys believe that? With God, it's possible. So we think you can do it. So what we want to do is to make sure that you have your workbook. Does everybody have your work watching online? Make sure that you have your workbook, and you have a pretest on pages 3 and 4. Did you look at that? All right, how'd you do? Did pretty good? Okay, Regina, she's gonna come around and check those pretests and give you the answers towards the end of our class. So make sure that you have your pretests done on pages 3 and 4. For everybody watching online, you have a special discount code that you can use for the full program, RNU. So that's RNU at remarnurse.com. If you use that code, you will have $50 off of your full study. You also have the ability to get Regina's newest book, First Shift. She's going to talk to you a little bit more about that, how to dominate your first 2 years of your nursing career. This is everything that she did in the first 2 years of her nursing career to set herself apart, to be a leader upon the unit, and also to distinguish herself as a new nurse. If you're endeavoring to enter into nursing school, we have quick facts for TEAS and HESI. That's available online. It's a new resource. And of course, if you're looking to you don't know where to start, make sure that you have the quick facts book. In fact, I want to ask, how many people you here have the full program already? How many of you have the full program already? All right, you say you just got it today? Well, then you got it, right? You got it. You in there. You on the way. It's going to take 6 weeks to go through the material, 8 weeks if you're not comfortable, just to give yourself a little bit of time, and you can go ahead and get your license. So we are so excited. But if you don't know where to start and you're saying, I want to do something, Quick Facts is definitely the way to go. We also have something called a prayer booth, right? And it's simply our way of saying that we take God wherever we go. It's the reason that we have a stage to stand on. He is the reason we have a stage to stand on. And let me just say it like this. I don't, everybody isn't a person of faith, and that's cool. But, if you've tested, you gotta throw a prayer up. You like, seriously, you have to, in fact, you might just have to get on the knees and say, Lord, please, if it is your will, Lord, would you help me? And so we want to make sure that we're mindful of that. We have our prayer booth outside, and some words of encouragement to share with you that will help you take your studies and your nursing career to the next level. Part of our spiritual development piece, we want to say, seek ye first the kingdom. Of these things will be added unto you. All right, here that you've all been waiting for. Let's go.
Thank you so much. Thank you. Awesome. Good job, good intro. No? Okay. Can everybody hear me? Yes, you feeling good today? I'm so happy to be home. Like Mark said, we go all over, but to be in Youngstown, Ohio is really special to me. I started my nursing career very young. I graduated from the Rayan High School. Anybody know Rayan? Kinda, yeah. When I was 16 years old, after I would come from cheerleading practice, I would get dropped off on the bus, and I would go into my house. My grandparents, they lived on the south side. And when I would go into the house, I always had to ask myself a very important question. It was like the question of the day. And that question was, who needs to be changed? Who needs to be changed? And the reason why I had to ask myself that question is because in the dining room where we used to, put our book bags and put up the Christmas tree was my grandfather. He had a stroke, and after his stroke, he couldn't swallow, he couldn't walk, he couldn't talk. So he was bedridden, he had 2 feet, so he needed to be changed. Or in the living room was his wife, my grandmother. She had diabetes, so she lost her vision and both her legs to diabetes, and she was bedridden. So when I would get home from cheerleading practice, one of those two had to be changed. And some people would think, man, that's really overwhelming for a teenager to come home to, but it wasn't. Like, there was a home health nurse that literally taught me how to care for those two, and I didn't have any clinicals, any PowerPoint presentation, anything like that. So I felt so confident by how she taught me that now it's my goal to teach you guys just how she taught me. Very straight to the point, very simple, so that you can be successful nurses. So is that okay with everybody? All right, so I have just 2 goals. Today, I want to transfer everything in my brain that I can into you guys' brain, right, while you're here. And then I want to teach you how to study when you leave this place. Because the real work of becoming a nurse, studying, of passing your test is done at home. It's not what you do here. It's not what you do in class. It's what you do at home, okay? So for the next 20 minutes, I'm going to spend working on the workbook with you. I'm going to let you take a break, all right? Because we can't cram everything all in one setting. All right, and then I have an awesome surprise gift for you. It's actually our pastor. He's back there. He has some words for you guys, and then we're going to get back more into it, okay? So I didn't see the count. How many of you are pre-nursing students? Just a couple. Everybody else has been in nursing school? Okay. All right, so you'll be able to benefit from this either way, because if you're, the difficult thing about your pre-entrance exam is that you have to know a lot of anatomy to get into nursing school, and then the difficult thing is if you've been through nursing school, you still have to remember that anatomy, although you've learned so many other things, right? So get out your workbooks, we're gonna get started. Okay, and those are my grandparents that I took care of. All right, yeah, those are my guys. All right, so I hope you did the pre-test. I am going to check it. I want to know how everybody did. And we're going to get started. Everybody, and I wanted everybody to have a workbook because I wanted you guys to see how easy it is, whether you're in nursing school or not in nursing school. I wanted everybody to see that you can learn this information if it's presented in a certain way. All right, so we're going to start with the neuromuscular system. Everybody write that down, okay? That's the first thing we're starting with. And the neuromuscular system is a combination of two systems. What are the two systems here? The nervous system and what else? Perfect, neuromuscular system. So this system is really important. What page are we on? Everybody should be on page 4, okay? Okay, yep. So this system is really important because it does what? It provides communication between the muscles and the nerves. And you need that to happen in order for your body to move, right? You need that communication. You will see that as you're studying for the exam, our bodies work together. There's not just one system that works by itself. All of the systems work together in order to make your body function the way that it does. So these are very important concepts to know for our exam. So when we talk about movements, when we talk about the neuromuscular system, there's two types of movements that you want to know. They're the involuntary and the voluntary movement. When I say involuntary, what does that mean? If something's involuntary, what does that mean? Yeah, it goes on irregardless. I like that. You don't think about it. It doesn't take a conscious thought, right? Where voluntary, you have to think to do it. So let me give you some examples of involuntary movements. Breathing, right? You don't think about doing that. It just happens. Also, your pulse or your heart rate. Oh, you did that. Sorry about that. There we go. Breathing, your pulse. Your digestion, we're not thinking about that. It's just happening. And also blinking. You do that and you don't really think about it. So I have a note at the bottom of your page there that your involuntary movements come from that autonomic nervous system, right? Autonomic nervous system that uses smooth and cardiac muscles as a part of that. When we think of the voluntary movements, voluntary movements are what? Walking, talking. Yep, you make that decision when you're going to do that. Also, I have eating and bathing. So, thank you. Okay, so these movements are controlled by a different group of muscles. All right, and these are the skeletal muscles. And the reason why I'm going over this basic anatomy for you guys that are already been through nursing school is because every level that you go higher and higher in nursing, you have to go back to this. So right now I'm in school for my PhD, right, in nursing. Guess what we're studying? This stuff, right? It never leaves us in nursing. So involuntary, voluntary movements. How do the muscles know when to move? It's the nerves that are attached to muscles that allow them to know, hey, it's time for you to move. So I have there the definition of what a nerve is, right, for you guys there. Just haven't seen it in a while and you're not really sure. Okay, so this is the neuromuscular system. So the communication comes between the nerves to the muscles. Now, we look at the nerves, but we know that there are two places where nerves come from. We have a central nervous system, and what's the other place? Peripheral, good, yes. So the central nervous system, this is the next page. And we're doing a general overview. The central nervous system is your brain and spinal cord, okay? When I talk about central nervous system, that's always your brain and your spinal cord. Whereas your peripheral nervous system, these are the nerves that are in the periphery of the body. So the arms and the legs outside of the spinal cord, okay? So when we talk about studying, this is what studying looks like. It's supposed to be a review of information. People will email me and they'll say, how many questions do I need to pass NCLEX? How many questions should I be doing? Have you heard that before? 70 questions a day, 100 questions a day? That's the wrong way to study. You don't start first with questions. You start first with this stuff. Because if I asked you a question about involuntary movements and you don't know what it is or remember, it's gonna be hard for you to answer those questions. You're gonna waste a lot of time answering wrong questions, okay? So I always want us to start with content first, okay? So remember when we talked about the muscles, there are 3 types of muscles, okay? So if we're filling in the blanks, we say, remember the cardiac muscles and smooth muscles help us with involuntary movement, okay? The cardiac and smooth help us with the involuntary movement, and it's the skeletal muscles that help us with the voluntary movement, okay? And when we talk about moving and muscle movement, we have to understand that anytime we say a skeletal muscle is moved, we understand that that's something that we can control or not control. But there are times when when the muscle is either contracting or relaxing, okay? And with HESI or TEAS or NCLEX, they can say the same thing 3 different ways. So you may see contracting or relaxing, you may see dilation or constriction, right? Or you may see lengthening and shortening. And that's what makes studying for these exams so hard too, is because in medicine, there's like 3 ways to say one thing, okay? So muscles are contracting or relaxing when they receive signals from the nervous system. And it's important to know that each skeletal muscle is attached to a nerve. Let me ask you this. Do you guys think the cardiac muscles, is each cardiac muscle attached to a nerve? No, the cardiac and the smooth muscles are not always attached to nerves, okay? Because they don't need nerves to tell them when to move. What tells the heart when to move? Yes, so it's an electrical impulse, not a... What electrolytes tell the cardiac muscles to move? Potassium, what's another one? Sodium, there's one more I'm looking for. Calcium, okay? So those are the 3 that are important for the heart. Potassium, sodium, calcium. So these are electrical impulses, not nerves, all right? And that's for what type of, who remembers what are the 3 classifications of muscles? Smooth, cardiac, and skeletal, okay? Smooth, cardiac, skeletal are the 3 types of muscles, all right? And this is why this review is good. This is why this is good, because sometimes we forget. Any questions about anything you guys saw? All right, this is the time, too, to ask questions. Don't be afraid. I want you guys to ask questions here as opposed to taking them home, okay? Ask me questions. Okay. So what exactly is making the muscles move? Muscles are made of myofibrils, okay? Myofibrils. Now, what's interesting is that the myofibrils break down even further, okay? So you want to know this. The myofibrils contain sacromeres. sacromeres. And this is what actually contracts or lengthens, okay? And when we talk about muscle tissue, how does muscle tissue look? Has anybody ever seen a cadaver or seen muscle tissue? What does it look like? What makes it look different from other tissue? Striate, right? So this is what's striate, the sacromere. And I have there at the bottom of your page, if you're taking an entrance exam, you have to know this, all right? So you have to know the thick, all right, the thick and thin filaments that make the muscle tissue striated. And I have it there for you guys at the bottom of the page. Everybody see that? Okay, so the entrance exams to get into nursing are really tough because you don't typically talk about this before nursing school, but you're expected to know it if you want to be successful in nursing. We did a little content. Let's do the questions. Let's see if we can do those questions. Okay, I'm ready on the 6 with me? Okay, so now that we went over the content, we can do questions. First question says here, a jogger comes in with moderate pain and in the quadriceps tendon. Everybody know where that is? Yeah, following. If you have swelling in a tendon, avulsion, sprain, or fracture. So you saying, everybody saying A? Yes, that's correct, yeah. So the way I remember this is strain, the difference between strain and sprain. Strain has a T in it, so I think what? You guys, which of the are involuntary? Select all that apply. What's the answer? A and C. A and C. Yes, ma'am. That's what you got. Yes. A and C. But this would have been tough if we didn't just go over the content, right? We would have been sitting here like, I don't even know. But when you go over the content, then you can answer the questions a lot easier by doing that process first. Okay? 3, what type of signal is transmitted in a neuron? Electrical, okay? So C, all right. So what I just tried to show you there is that there is a way to do this studying, all right? And everybody's process should look pretty much the same. Even if you're a new graduate or you've been out, start with studying the information first, okay? So that was just a quick overview of the neuromuscular system. It didn't take us long to do that, but it's very effective because you guys will feel more confident if you see questions about the neuromuscular system. All right, so I want to look at another system, and that is the respiratory system. And the rest follow the neuromuscular system because when you talk about respirations, most of the respiratory processes voluntary or involuntary? Involuntary. So what kind of muscles will the body be using? What kind? Smooth muscles, right? So it goes along with the system, and it brings the point back that there's no system in the body that's working alone. All right. So we're going to fill out the page there. We're going to start with talking about okay, so we just went over these questions. Be sure everybody had the answer. We know that the lungs are the cone-shaped organs, the heart. Now, what's interesting about the lungs is that they are not the same size, right? Which lung is bigger, the left or the right? Lung has 3 lobes, and the left lung has just 2. And that's because it makes room for the heart, A balloon, I don't know if you've ever seen it, but it's shiny, it's watertight, it's airtight, and the lungs sit inside of the pleura. So it's what allows the lungs to contract and expand without having friction inside of the chest. All right, so it's the slip. Here, the system is responsible for breathing, which we also call respiration or ventilation. All mean the same thing, okay? And the ventilation that takes place involves gases. And the two gases are what? Oxygen and carbon dioxide. Mm-hmm. Yep. Okay. The upper and lower respiratory tract are important because the parts of the anatomy that make up these two tracts are what we enter and exit when we try to help a patient breathe. So it's important for you to know what makes up the upper respiratory tract and the lower respiratory tract, because when we get into infections, they're located in a specific place. So our upper respiratory tract is really the first defense for our body. And that is the nose, the mouth, the pharynx, right? And you also have the larynx, which splits in half. So the upper part of it is the upper respiratory, and the lower part is the lower respiratory tract, okay? So whenever we're talking about protecting the body, the respiratory system is one of the major protectors of our body against pathogens and viruses, and even just breathing. Because if you think about it, the air that we breathe is very harmful to the body. So there are certain things that have to be done before that air gets to your tissues. So we're sitting in this room right now. How warm is this room? What would you say if you had to give it a degrees? What would you say? 60, 62, 70? It's kind of cold in here, right? It is cool. How hot is the body? 98.67, depends on where you're going. So what does the upper respiratory tract have to do to the oxygen you're breathing in right now? It has to heat it up. It has to put moisture in it, because if you just took in this 62, 68 degree air, it's going to damage your tissues, right? So this upper respiratory tract is so important to keep the body healthy, to keep the body safe, all right? The lower respiratory tract plays an important role in making sure that that nice, warm, moisturized air actually gets to the vessels. So you have the larynx, you have the trachea. Remember the trachea bifurcates or divides into the bronchi. All right. So this is the lower respiratory tract. And it is much more sensitive when it comes to pathogens. So if a pathogen makes it down here, it's going to do some damage. It's going to do some damage to the body. Okay. Are we good? You guys are still with me? Okay. All right. All right. So I wrote a lot of the notes out for you, and this is how I do it in my program. Already in the workbooks, if you guys have them, I take most of the notes for you. So I only want you writing things down that are really going to be impactful, okay? So the air that we breathe in, the system that we breathe in, works on negative pressure. Does anybody know what that means? Not all at once. I can't hear everybody. Exactly. So normally the lungs are collapsed, right? But when we breathe in, what happens to the lungs? They expand. So the diaphragm drops so that air can come in. That's an example of like negative pressure, okay? So it's the pressure on the outside of the lungs is greater than what's on the inside normally. And that's why the lungs are usually collapsed, okay? That's negative pressure. Breathing in general is mostly an involuntary action. But the diaphragm is really special because It has skeletal muscles in it and smooth muscles where you can control it if you want to control your breathing, but if you don't want to think about it, you don't have to. So the diaphragm is really important in that way. And the entrance exams like to ask about it a lot. So breathing is mostly an involuntary action. Lung tissue expands during inspiration. The diaphragm relaxes during expiration. Okay. All right, and I think I put in the workbook the control center of the brain and other things that you can read and study if you're not familiar with it. As you study, one thing that I want you to really keep in mind is that if you come across something that you don't know, that you've never seen before, when you go home, what do I want you to do? Look it up. Yes. All right. If you see something that's like, I don't know what she's talking about, I don't know what that means, you have to look it up, because you will see it on the exam and you will say to yourself, I really wish I just would have looked it up when I had the chance. Okay, that's what always happens. So let's talk about a pathogen, because we went over the normals, so now we can talk about abnormals. So I just want to look at 3 that are covered on NCLEX and on the entrance exams: allergies, asthma, pneumonia. Allergies, asthma, pneumonia. So the first abnormal respiratory problem is allergies. And this is an environmental response. So we're going to look at the cause, the symptoms, and the treatment. That's a great way to study something. When we talk about allergies, the causes are going to be environmental. So outside, right? Dust, mold, pets. This is not something that's happening from within. This is something that you've come in contact with. So how is the body going to respond? What is the immune response to an allergen? The immune response is rhinorrhea, sneezing, watery eyes, itching. Okay. Common allergic response, very common. So what are we treating? Are we giving a lot of medication if somebody says they have allergies? Do we want to give them a lot of medication? No. What we want to do is to identify what's causing the response. That's the best way. And then if you do give a medication, it's typically an antihistamine. Okay? So very simple, but good to review. Any questions about allergies? Okay, let's move on then to asthma. Asthma, it's the next page. So when you have asthma, what we call asthma an acute attack or a chronic attack? The attack, is it acute or is it chronic? It's acute, but is the disease acute or chronic? It's a chronic disease. So that means usually when people have asthma, if it's chronic, they have it for longer than what? 6 months, okay? 6 months means chronic. Yeah, 6 months means chronic. But the attacks are usually, they come on pretty fast. So when we talk about asthma, it is a lung disease. It is, okay? That causes inflammation and narrowing of the airways or constriction. Okay. So basic signs: inflammation, narrowing of the airways. Okay. So when a patient's having these asthma attacks, what do they? How are they anxious? Do they have anxiety? Absolutely. Wheezing. It says here for asthma, there's a cough. When does that cough usually happen, in the day or night? Night. It's a nighttime cough. Okay? Good. So, to normal treatment. Okay? They don't respond to normal treatment. So if you haven't ever heard of this before, I want you to take some time and look it up, okay? Because you need to know, how do you treat this patient? How do you treat this patient? I want you guys to know that, okay? So status asthmaticus, status asthmaticus. What do we do to treat? So the routes that we usually treat our patient is PO. What does PO mean? By mouth, and also an inhaler or a nebulizer. And the medications that we give are going to be our bronchodilators and our steroids. Bronchodilators and our steroids. Now, let me ask you this question really quickly. If we give a bronchodilator and we have to give a steroid, which one do we give first? Should we give the steroid or should we give the bronchodilator first? Bronchodilator, yes, yes. All right. And we got to do ABGs, of course. Always want to do those. And we will find that the patient has respiratory acidosis. Respiratory acidosis. And then, why would the client need emotional counseling? Because they're freaking out, yes. Or in other words, they have anxiety, right? It's very scary when you cannot breathe. It's very scary when you cannot breathe. Any questions about asthma? Perfect. Okay. Are you guys learning? Is this helpful to you guys? You're like really quiet, so I'm taking it that you're just writing everything down, trying to study. Okay. All right. The last airway issue that I want to talk about is going to be, what is it? Do you guys remember? Pneumonia. Yes. So pneumonia is the most severe of the three. Only because it is an actual infection of the lungs. It's an infection of the lungs. So when we talk about pneumonia, and I want you guys to look at this X-ray here, is this the upper airways or the lower airways? Is it upper or lower? No, remember, we're down here into the what? Okay, so this is the lower airway, so lower respiratory tract infection. Yeah. There are two types of pneumonia, bacterial and viral. Bacterial and viral. This is really significant when you think about how two ways your body can be attacked. It's the same for, like, if you're studying meningitis, there's two types of meningitis. There's bacterial and pneumonia, right? Bacterial and viral, meningitis. So when we look at the two types of pneumonia, which one is going to be worse, the viral or the bacterial? Bacterial is always worse, okay? No matter what you're studying, if it's meningitis, the bacterial meningitis is worse than the viral. So here, it's the same, okay? Mm-hmm. Yeah. Mm-hmm.
And even with the viral, even though it can be treated, but it takes a period of time.
Mm-hmm. Yeah.
I was assuming
That the
can be.
Sure. So her question is basically, which is worse, or why is the bacterial worse than the viral? Okay. So let's think about it. When you have a bacterial infection, such as bacterial pneumonia, is the recommendation to just ride it out and go through the symptoms? No. You need to get treated, roll through the symptoms, because your body will eventually combat the virus, right? But for a bacterial infection, the body is more susceptible to being overcome by that infection. So that's a great question. Does that make sense in the treatment? Mm-hmm. Mm-hmm. Yeah. Mm-hmm. Well, this is the thing. There is treatment for it. Like they have antiviral medications. So if a patient does get pneumonia and it's a viral pneumonia, if the patient is already immunocompromised, they may put that patient on an antiviral medication. But you don't always have to be, because your body can sometimes be strong enough to withstand the virus. But with the bacterial infection, your body's going to take a very hard hit if it has a bacterial infection. So there is treatment to break down that bacterial wall. Not to say that it's less harmful, but treatment has to be implemented right away as opposed to you holding on to that bacteria. That makes sense? Those are really good questions. Good questions. Okay? So the signs of pneumonia, very similar to other respiratory diseases, okay? So you have a fever because you have an infectious process going on. You're gonna have a cough. When do you see that cough? Is it day or night? It's a nighttime cough. So see, sometimes you have current themes that come up and it helps you to study more effectively. So just like with asthma, with pneumonia, you're gonna have a nighttime cough. How is the patient gonna feel? Fatigued, achy, tired. Shallow respirations. Why are the respirations shallow or decreased? Your lungs can't expand, right? And why can't the lungs expand? What is there that shouldn't be there? Mucus, fluid, yes. Okay, so you guys are this is how we critically think. This is how we study, right? So the respirations are going to be shallow, and then it's also going to be very painful because you have fluid where it's not supposed to be fluid, okay? All right, isolation. You gotta know isolation. Yes? Yes, does anybody know it? I have the answer, but does somebody know it? Yes. Yeah, that's pretty much it. And then how do you usually rest at night? You're supine, right? So the mucus is there more as an irritant, and it's in one place, where when you're up, you're walking around. Every step you take is moving that mucus around. Does that make sense? Yeah. Yes, ma'am. Okay. Sure. I think it's going back to the cause. So when we talk about pneumonia, there's actually a pathogen in that case that's causing mucus production, where asthma is a narrowing of the airway, okay? And it's an acute narrowing, and it happens right away. Well, somebody with pneumonia, sometimes they can have it for how long before they know they have it? They can walk around days with it. When you have asthma, you know right away that you can't breathe, right? So that's one of the differences. That's a good question. Anything else? Yes, ma'am. Walking pneumonia is just a moniker that means that the patient doesn't have pneumonia. So they have it, but for some reason their body is compensating where you don't have the severity where you think, oh, I'm sick. You're just walking around with it. Does that make sense? I think that's the best way I can explain, is where your symptoms are not manifesting to where the person feels ill, and they're just carrying the bacteria or virus around.
Excuse me, everybody.
It's not as severe. Yeah, it's not as severe.
For the benefit of our online audience, we have 1,000 REMAR nurses watching at home.
Hi.
We want to make sure that they can hear the questions too. So if you have a question, if you just raise your hand, we'll run a mic right to you so that everybody watching online can hear as well.
That's right. All right. So we'll wait for the questions until the microphone comes, because we do have an audience online that's watching. All right. And let me know if they have questions too. So isolation precautions for pneumonia. You have to separate these patients because pneumonia is what? Contagious. So that's another difference between pneumonia and asthma. Asthma is not going to be contagious. This is. So when we put a patient in droplet precautions, what do we have to put on as nurses? Okay. Do you need on a gown? A gown for droplet, yes or no? Yes. Do you need on a mask? Yes. Do you need on goggles? Do you need on goggles to cover your eyes? If somebody's gonna cough in your eyes? Yes. Okay. What else do we need that I didn't say? Gloves. Okay. All right. So you got to know isolation for NCLEX, and I wish I could stay and talk about all of this stuff with you guys, but very important. So droplet precautions. When a patient is on droplet precautions, that means they're contagious within how many feet? 3 feet, remember? So if you're within 3 feet of that patient and you don't have on your protective equipment, you can get that. You can get that disease, pneumonia, influenza, meningitis. These are all droplet precautions, all right? So before you take NCLEX, make sure you know droplet precautions. Did you have a question? Oh, no, okay, all right. All right, so isolation, let's talk about the treatment now. So we kind of mentioned it. You want to separate these patients right away. They cannot be in the same room with another patient. It's also why when people get flu, influenza, usually everybody in the entire house gets it because they pick it up through droplet transmission, okay? Also, you can give an antiviral. If you have to, you really try to stay away from viral, so there's medication for both. And then you can give a cough suppressant like guaifenesin as well. Yes, sir?
Would it make sense to just treat for the worst?
No, because if you have a viral pneumonia and you give a bacterial medication, is that gonna work on the virus? No. So it's not, I see what you're saying. Just go right for the yeah, but no, you wouldn't do that because antibiotics or antibacterials, they have their own side effects. You know what I mean? So if we give a medication like an aminoglycoside, like vancomycin, you give somebody vancomycin and it won't take care of the condition, then you just medicated the patient, and vancomycin is one of those medications that can cause the patient to go deaf. They can lose their hearing because it was given without a just cause, okay? So, gotta be careful for that. Also, we encourage the flu vaccine to prevent influenza, pneumonia, those type of things. Yes, ma'am. Sure. Oh, wait, hold on, I gotta do this. Yeah. He spoke loud.
In most nursing homes,
Yeah.
They don't put people in isolation with pneumonia.
Mm-hmm.
And I mean, you say that's one of the things that we have to do.
Sure.
Do you know why?
Yes, I do. Oh, so I don't need this? She can keep. Okay, so this is working. So they'll come. Can you come? The research shows, remember, how is it when we're taking our board exams? It's a perfect world. So in a perfect world, anybody with pneumonia is going to get their own space. They're not going to share. We're going to have gloves. We're going to have gowns. We're going to have everything outside of the bedside. Everybody gets their own blood pressure cuff, their own everything, right? For the board exams. But in the real, everything you need, right? That's how I want you to think about it. So if you're, and that's why sometimes when you're already a nurse, like if you're an LPN and you want to transition to RN, it's very difficult to pass the board exams. Very, because you carry all your real world experience into that test and it doesn't apply. The things you do more than likely are wrong by research standards, okay? So I need you guys to blank everything out that you know and just really focus on by the book information. So that's a great question. Yeah. Okay. So let's do these practice questions. It shouldn't take us long. When you're doing questions, I'm not even going to give you guys a minute to do them because I think you just know this stuff right now. So question right now, it says, what gas is a waste product of respiration? Is it 1, methane, 2, oxygen, 3, carbon dioxide, D, nitrogen? Which one? C, right? Okay, everybody watching at home, carbon dioxide, of course. Second question says this: How is waste expelled through the body by the respiratory system? Is it A, through inspiration, B, peristalsis, C, expiration, or D, tears? C, okay. So you guys are all nurses, so it's kind of super easy. But I got the pretest, though. I know the pretest gave some people some trouble. So we'll go over that. Okay, what is the correct sequence into the lungs? What do you guys think? So A says the bronchioles, trachea, then bronchi, lungs. B, is it the trachea, the bronchi, the bronchioles, and lungs? You might need to look at the picture. C, lungs, alveoli, bronchioles, trachea. Or D, trachea, bronchi, alveoli, bronchioles. It's like, no idea. I don't know, Regina. I don't know. Correct answer, B. Correct answer, B. That's basic anatomy, okay? So, yep. Make a note by that so you can go back and study that later. Okay, so, did you guys realize that we just studied like 2 systems and 3 diseases all within a short period of time, right? Was it hard to study that information? Was it boring? No, it was engaged, right? So I'm here today. One of the things to do, transfer my knowledge to you guys, but also show you that studying for your board exam shouldn't be difficult. It shouldn't be hard, and it most importantly should not take you months and months and months to do it, right? So right now we're going to take a break. Okay, we're going to take a break. 15 minutes, go outside, prayer booth, fresh air, come back, and we're going to hit our NCLEX prep. All right, we're going to focus on that, do the pretest, and then I hope that you guys have questions for me to ask me about how to use the program, how to pass NCLEX, all right? And then we'll also have our motivation from President Cox, which I'm really excited about as well. All right, so 15 minutes.
How long have you been out of nursing school? Go ahead, don't be afraid to say it. What they never talk about in nursing school is what happens to those nursing students who don't pass NCLEX on their first try. You may have been out of school for several years. You're studying, you're buying all these expensive products, you have test-taking anxiety, you're going to the exam, you're getting the courage to take the exam, but then you get that report that you did not successfully pass. I'm going to help you. Here's what we're going to do. So if you've been out of school for 2 years, if you've been out of school for 8 years, if you've been out of school for 11 years, I want you to give Team Remar a call. It's 855-625-3966. I'm going to tell you again. It's 855-625-3966. Tell me how long you've been out of school, and I'll send you a message. And I'll make sure that you get the products that you need. This is your year. You want to be a nurse, right? You said you wanted to be a nurse. You said this was your year to get your license. And I want you to do that. I want you to keep your promise to yourself because you deserve to be a nurse. You can, you will, and you must pass NCLEX.
Okay, so my journey began in December of 2018 when I was just scrolling through YouTube and happened to discover Rebar review. And I was like, what's this, And I watched it. I watched the Monday Motivation. I watched pretty much everything. I even went back, before and watched some of the older programs that she had on. And it definitely held my interest. I finished school in 2014, graduated 2014 of January. And it's been a long journey for me with the NCLEX, a long battle. I look back and realize how many times I have taken the NCLEX exam. I didn't even know. I've taken it 9 times already. And since December of 2018 up until now, August 15th of 2019, I just passed my RN NCLEX. And I just want to say thanks to the Remar family, to Regina and Mark for everything. So I want to show you, I did buy the complete package. I printed every single freebie that she had available, the 7 days of NCLEX. I mean, anything and everything that she made and had available, I made sure that I printed it out and I made sure that I did everything. Okay, I took these books to work with me on a daily basis and I opened them whenever, wherever, and anytime that I had possible, I studied. I definitely tried to stick to the plan of not going over more than 2 hours a day of studying, and it worked because I am an RN now. I just want to give you guys a little rundown of my day before the NCLEX. So the night before, I made sure that I had everything laid out. I made sure that I had my directions set in my phone, to the NCLEX location testing site. And I got a good night's rest. I scheduled my exam at 2 p.m. in the afternoon because I did not want to wake up early because I'm not an early morning person. And it worked out for me. I got up that morning. I got prepared. I didn't open any books the night before. I didn't open any books the morning of the exam. I had plenty of time. I got to the testing site early. I actually went in early because I got there early. And as soon as I sat down at the computer, I said, I can, I will, I must pass NCLEX.
Want to pass a test, if you want to overcome a generational habit, if you want a better marriage or relationship, if you want to have a deeper relationship with God, understand clearly that you need help. You may not even act like you need help, but if you want to reach your full potential, you have to be moved outside of your comfort zone. And so Jesus touches the man. Then he steps back and he says, what do you see? And the man says, I see like trees. He's better, but he's not at his best. And so now the request, touch me again. And Jesus touches the man again, and the miracle ends with the man being able to see. Stop by to tell you that today, as you're getting all of this wonderful knowledge and you're now having an opportunity to utilize a process that can enable your dreams to come true, there is one that loves you, who wants the best for you. Maybe in the past you've had a relationship with him. Maybe you've not had a relationship with him. It does not matter. He loves you with an everlasting love. I'm thankful, theologians will say that there are these big words that explain what a relationship with God is all about. And they start off with justification. The simple definition for justification is the ability to be credited with God's righteousness before you start doing what is right. That eliminates any excuse not to accept Jesus right now. If I could get right before I came to the Lord, there would be no need to come. So I get to come just the way I am. Being honest with myself, being honest with God. I simply say, Lord, in a confession of faith, I believe that you are who you say you are. I believe that you can do what you say you can do. I believe that you're doing it even when I don't see the evidence Lord, I believe. Jesus comes into our hearts. He touches us again. This spiritual emphasis just gives us an opportunity to be a part of a prayer that will allow the Spirit of God to give us that added impetus that can enable us to experience the desires of our heart. And so in these closing moments, I would just ask if there is anyone. We certainly have individuals on the outside who are willing to pray with you. But I'm going to share a prayer right now. And if you would like to be a part of that prayer, would you just stand right where you are? We're going to pray. It's not by our might, nor is it by our power, but by God's divine Spirit. Loving Father, here we are. We are so thankful for each one of the individuals that are in this room. You created them with a specific purpose in mind. They are desirous of being your hands and helping to bring about healing in the lives of those who are sick. Lord, there's a process that they have to go through, and you know the beginning from the end. And regardless to how many times they have tried, we are thankful today that you are God that has promised us victory when we depend upon thee. And so in the words of Scripture, we ask that you would just touch us all again. Fill our lives with your power, knowing that with you all things are possible. We're going to give your name all of the praise, the glory, and the honor. In Jesus' name we do pray. Amen. God bless you.
Okay, we're going to get started looking at our final topic, and this is our NCLEX topic that I really love to teach about. I love teaching NCLEX, all subjects, but this is one of my favorites because it's complicated, but at the end you'll see it's very simple. So we're going to talk about congestive heart failure. Congestive heart failure. What page am I on? 13. Okay, so congestive heart failure, when you think of congestive heart failure, I want you to think of the lungs, but I actually also want you to think of the kidneys, okay? Because they're very related to the heart in this condition. So congestive heart failure, let's fill out our books, is when the heart can't produce enough to feed the other organs, right? That's congestive heart failure. But what's the bigger problem with congestive heart failure? Let me say this. With congestive heart failure, the kidneys are affected, very much so. What is the job of the kidneys? To do what? Filter fluid, remove fluid, right? So when the kidneys can't do their job, what do we have a problem with? All right, so our big problem with CHF is fluid overload because the kidneys aren't getting what they need to do their job. So the body is going to retain fluid. So when you're taking NCLEX, NCLEX wants to know, where is the fluid located? Is it going to be on the left side or the right side? Where is it going to be located? So there's an easy way to remember fluid buildup with congestive heart failure, whether it's left-sided or right-sided, okay? Are you guys with me? All right, let's look at left side. How do we know the fluid will be on the left side? How do we know a patient will have left-sided congestive heart failure? Because all of the fluid will be where? In the lungs. And there's an L in left, and there's also a L in lungs. So it's really easy to remember that for your exam. Now, when we have too much fluid in the lungs, what kind of signs are we going to have? We're going to have what? Shortness of breath, crackles, right? Are we going to have a cough? Yes. What does it look like when a person has left-sided CHF? What are they coughing up? Frothy pink sputum. okay? That frothy pink sputum. That's left-sided heart failure, all right? So we have shortness of breath, cough, crackles, that O word, orthopnea. Does anybody remember what orthopnea means? Yes. Exactly. So anytime I get a patient and they tell me, oh, I don't sleep in my bed, I sleep in the living room chair. You know, I haven't been in my bed for 2 years. I know what kind of problem they have. This person has heart failure. Or if somebody says, I sleep in my bed, but I sleep on 6 pillows, right? So they're upright in their bed. That's classic left-sided congestive heart failure, all right? So restlessness and tachycardia also, because if you can't breathe, then you can't get comfortable. So my patient with CHF, they're up around, even at night, they're walking around their room, they're not sleeping, all right? So easy way to remember left-sided. Now, how do we remember right-sided? With the right-sided CHF, all of the fluid will be in the rest of the body. So it's not in the lungs, it's in the rest of the body. So signs of right-sided heart failure: peripheral edema. Your legs swelling up at the end of the day, right? You can touch them and leave indentations. That's right-sided heart failure. Okay. Also ascites. What's ascites mean? A swelling abdomen. You collect fluid in your abdomen because the fluid doesn't have anywhere to go because what's not working? The kidneys isn't working to get rid of the fluid, so the body holds on to it. So it starts filling up in other places. So you have distended neck veins, right? Enlarged organs. The liver begins to hold water. The spleen, the heart, right? These are all signs of right-sided CHF. And also the weight gain, classic, because you have the fluid. All right, so these are really easy ways to remember difficult subjects. So we talked about what it is, what are the signs. Let's look at this. Most clients will have right-sided and left-sided CHF. So they'll have it on both sides. What is this an example of? Distended what? Yeah, distended neck veins, okay? So typically a client will have left-sided CHF and then it'll move to the right. Okay. Yeah. So our diagnostic tests for congestive heart failure. First one is an arterial blood gas. Okay. And those are really easy to do for NCLEX. The second is a chest x-ray. What is the chest x-ray going to show us? Fluid. It's going to show us fluid. What else could it show us if we see things up here? Enlarged organs, yeah. And then the last one is a pro-BNP. How many have heard of this before? Okay. This is a laboratory test that is specific for congestive heart failure. All right, specific for congestive heart failure. Anybody who has a pro-BNP over 100, has congestive heart failure, right? And what's the problem with congestive heart failure? They have too much what? Fluid, right? So I always tell this story. I was visiting my husband's dad in the hospital, and I noticed that he had IV fluids running, right? So I knew he had some heart failure issues. He had some fluid issues. So I asked the nurse what was his pro-BNP. And she said, what's a pro-BNP? Right? So she didn't even know what it was. So then she looked it up, and I saw he was getting IV fluids, and guess what the pro-BNP was? 4,000, right? So it was really high. So this is why you have to understand, you guys that are nurses, you have to understand that we don't just do laboratory tests for no reason. They have a significance. But if you don't even know what a pro-BNP is, how hard is it going to be for you to answer a question about it on NCLEX? You're going to struggle, right? So that's why we study content first. So these are the 3 tests I want you to know regarding congestive heart failure. Now, how do we treat it? We're going to give oxygen, right? Oxygen is going to help our patient to breathe. We're also going to give digoxin. What kind of medication is digoxin? It's a heart medication. How does it work, though, for CHF? What does digoxin make the heart do? It slows it down, but what is it doing to improve the patient? It's stronger. Yeah, it's improving the contractility of the heart. So it's very good in that way. What about morphine? What is morphine going to treat? The painful, right? And then the last one is, of course, what? Diuretics. So when you know what the issue is, it's very easy for you to know what the treatment is. All right? Final thing, our nursing interventions. Oh my goodness. What do we do if we have a patient with CHF? So we're going to check their weight. When do we check the weight? At night? First thing in the morning, same time every day, right? Checking their weight every day. The diet. I'm going to put them on a cardiac diet, so that's low sodium. Do we do a fluid restriction? Yes, it's appropriate to do a fluid restriction for this patient. Okay. We're going to put these patients on bed rest to limit their activity. Okay. And then we're going to monitor for oxygen toxicity because oxygen is a medication, right? And also very important, when you give a patient a medication like digoxin, you have to know the signs of digoxin toxicity. Can anybody give me some of them? Nausea and vomiting, yes. What will the patient see? Yellow halos, yes. Okay. If you have the Quick Facts book, in the back of the book is medications that go over this. Okay. So we just did CHF. You guys know what it is. You know what to look for. You know the signs and treatments, and we did it in like 3 minutes. Okay. You can do this. Everybody in here can pass this test. So let's do these questions. We did content first, and now we're going to do some practice questions. Let me grab my book. All right, question number 1. I think I actually have it. Okay, a nurse is caring for a client at an assisted living facility. The client has a history of CHF. After a 20-minute shower, the client complains of acute chest pain. The client states he does not want to leave his room. He doesn't want to go to the emergency room. Which action is most important by the nurse at this time? Is it number 1, take the client's vital signs? 2, ask the client to take slow, deep breaths? 3, administer aspirin, PO, 81 milligrams, or 4, administer digoxin, PO, 5 milligrams, 0.5 milligrams. What do you guys think? 1, 2, what else? Anybody else? Okay. All right. So when we're doing these questions, I think we have to really get to figuring out what's the issue that you need to do. There's something you need to take responsibility for as the nurse. So what is this patient's issue? Is it the chest pain? We know they have a history of congestive heart failure, right? The client doesn't want to leave the room, doesn't want to go to the emergency room. What's a big issue when you have congestive heart failure besides the chest pain? You can't breathe, okay? So what's the best thing for this nurse to do for a client that says, I'm having chest pain? You know they got congestive heart failure. What's the best thing? 1 or 2? Which one is better? 2. 2, okay? You want this patient to take slow, deep breaths, all right? You want this patient to take slow, deep breaths because the issue is chest pain. The issue is can't breathe. So if we administer digoxin, is that going to help them right away? No. If we give them aspirin, what are we giving them aspirin for? No idea. Sometimes when you're taking NCLEX, there'll be choices, and you'll know automatically it doesn't make sense. Don't pick it. All right. And what's the problem if we take the vital signs? Could we take the vital signs? We could, but what's going to be happening to your patient while you're trying to get a blood pressure and a temperature? They're still going to be having that chest pain. All right. So that's what you need to address first, and then do the vital signs. All right. Are we on the same page? Yes, ma'am. Are you a nurse working now? No, because I follow your rationale. I follow your rationale. But the truth of the matter is that When you have a patient with congestive heart failure, how do you evaluate the severity of that congestive heart failure? By doing what kind of assessment? Do you do the vital signs or do you draw blood? Or do you do a breathalyzer or a nebulizer treatment? Like, when we're talking about congestive heart failure and chest pain, the vital signs won't tell us that much. We're going to get a temperature, we're going to get an O2, like you said, we're going to get a blood pressure, but all of this time, your patient's still having chest pain and possibly not getting the oxygen that they need. So in general, when you think about NCLEX, you wouldn't choose an equipment over the patient. And so that's what vital signs are doing. That means you're saying, hold on, I got to go find the cart, and then bring it back to your patient and do the vital signs. And so it's more of a safety issue for NCLEX that you left the patient to do vital signs, something like that. Okay, that's a good question. I know exactly where you are. And that's why I say ask the questions now, because somebody else probably had that question too, and they just didn't think about it. Any other questions about this? Okay, let's move on. Let's do this scenario, prioritization. Love prioritization questions. A registered nurse has just received a report on 4 clients. Who should be evaluated first? Who is the patient? So we have number 1, a 42-year-old diagnosed with pancreatitis who wants his DNR revoked. DNR means do not resuscitate me. So he wants to say, okay, I want you to resuscitate me now. 33-year-old who states his pain medication is not controlled after receiving medication. So his pain is not controlled after receiving his medication. 18-year-old who was recently pronounced dead, or an 87-year-old client who needs assistance to the restroom. Whew. Who do we see first? 2, 4? Okay. 2 or 4? Okay. You say 1? Okay. All right. So when we're doing priority questions for NCLEX, we want to know who is the patient that needs an evaluation or an assessment first, who has had a change in condition, who is going to die first. Okay. Those are the way we want to think about these patients. So 42-year-old diagnosed with pancreatitis who wants to have his DNR revoked. What's going on with him? What's the issue? What's the issue? Paperwork, right? Paperwork. 33-year-old states pain medication is not working for him. What's his issue? Pain. All right. 18-year-old, number 3, recently pronounced dead. What's the issue? Nothing I can do about it, right? 4, 87-year-old needs to go to the bathroom. What's the issue? GI, GU, okay? So for NCLEX, who needs to see the registered nurse first? 2, okay? This is how I want you guys to think about those questions. Don't get caught up in the distractors, because I guarantee somebody would have said number 3, oh, I really need to probably do an assessment to make sure that person's dead, you know? So you have to make sure that you're thinking about it in client safety, okay? All right, let's go on. Okay. 3, a nurse is discharging a client newly diagnosed with CHF. Which of the following is the priority for the nurse to assess? What's the most important thing if you have a patient with congestive heart failure? Is it number 1, client allergies, 2, monetary needs, 3, support system, or 4, spiritual needs? Okay, newly diagnosed patient, the nurse needs to know their, support system, okay? Okay, new diagnosis, you want to know how this patient is going to be able to manage this disease process, okay? Perfect. One more. Here we go for here, and then we do the pretest questions, so hopefully you guys have seen some growth from that. All right, the nurse is caring for a client with a CHF. You guys know CHF now. Which is the most important parameter for evaluating the patient's fluid status? Is it daily weights, urine osmolarity, fluid intake, or medication regimen? 1, everybody says 1. Yes, daily weights. So it feels good when you study the information and then do the questions first. All right, let's do the pretest questions and see how we did with these. How many people really did the pretest questions? Because a lot of people, I didn't see y'all do them. Y'all said, I don't know, I didn't do them. Okay. All right, pretest questions and then ultimate NCLEX practice. Right now, the code for those who are watching online, $50 off with the code RNU today. So that's the Ultimate NCLEX Success Program, my favorite. It literally takes about 6 weeks to prepare for NCLEX. And it doesn't matter if you're new out of school or if you've been out of school for several years. The way that I see it done, the best and the most successful, is in about a 6-week time frame. So I created this program for students that couldn't take an actual class. So when I go to a school or when I go to a city and teach a class, it's a 2-day class. I'm never there for 6 weeks, but it takes that long to prepare. So by these DVDs and these workbooks, it allows you to have something to do during that time every day. So one of the great things about my program is that I have a daily study calendar. And it's very realistic. I only have you studying 4 days a week. So everybody in here can study 4 days a week for about 3 hours a day. All right? And I have you with time off, with days off, because if it's not realistic for your life, you won't do it. I know students that get up in the morning, they say they're in the library from 7 in the morning till it closes at 11 at night. 2 things wrong with that. Number 1, I know you're not studying that whole time. You're on Instagram, you're on Facebook, and you have the appearance of studying, but you're not actually retaining anything. So if I keep your study session short, 3 hours, I know you'll make progress that way. Okay? Another thing is NCLEX is important, but it can't be your whole life. You have children, you have jobs, you have relationships. You have to be able to still have those things while you're studying. So this is the program that I created in order to help students pass their exam the first time that they take it. Okay? So if you do the program, you will see tremendous progress. And it doesn't have to be difficult and it doesn't have to be boring. All right? And when you come out of the program, you'll be a better nurse, you'll be more knowledgeable, and after you pass NCLEX, you'll be less likely to harm someone because you didn't know the information. Like I said, I speak to nurses all the time, and they can't tell me the difference between left-sided and right-sided heart failure. You guys literally learned it in 5 minutes, and you won't ever forget it. And that's the difference between being a great nurse and an average nurse. It's really what you know. All right? So I just challenge you guys to take the 6-week journey, do what you need to do, because after NCLEX, there's another level. And I'm standing here because I want you guys to get to that next level. And then also, I signed a lot of these books, How to Dominate Your First 2 Years in Nursing. It's my new product that I also have written for you all. All right, I started where you guys are. We're from the same city. We're from the same town. You guys can do even more than what you see me doing. So that's my expectation for you all. All right? Okay, let's finish up with our pretest questions. So this is information we went over today. Muscles are made up of which of the following? Number 1, long myofibrils. 2, short red strands. 3, short myostats. Or 4, long myodrones. What's the correct answer? 1. All right, we got that. All right. 2. A nurse is caring for a client with muscular disease where the client has reduced elasticity in her muscles. The nurse is aware elasticity refers to which of the following? When we're talking about elasticity, are we talking about, number 1, the ability to receive stimuli? 2, the abilities of the muscles to stretch. 3, the ability of the muscles to shorten. Or 4, the ability of the muscles to return to its original shape after extension. 4 for elasticity. So 2 is extensibility. Okay? All right. 3. All right, nurses. Everybody's been in nursing school. I need you to properly identify this muscle. Okay? What muscle is this in the photo? Everybody should know this one. Let me hear you guys say it all together. This is vastus lateralis. All right, this is where the IM injections go in the toddlers. Very popular muscle. Make sure you know this one, vastus lateralis. Okay. Okay, here we go. Same kind of thing. The nurse is caring for a client with pneumonia. You guys know pneumonia now. The client tells the nurse, I feel anxious. It's hard for me to breathe. The nurse notes that the client's lungs, they're clear. Okay. Respirations are 18. Is that good or bad? That's good, right? Client has an O2 saturation of 95% on 3 liters. Is that good? We'll take it. Okay. Which action is the initial action of the nurse? Is it number 1, instruct the client to calm down? 2, assist the client in slow, deep breathing exercises? 3, increase the client's oxygen to 6 liters for 10 minutes? Or 4, notify the healthcare provider? Everybody agree with 2? Is there anybody that says 4? I'm just asking. I didn't say I was right. Anybody say 4? Okay. All right. The correct answer is actually 2. Okay. Can somebody tell me why calling the healthcare provider is not going to be the right answer? Yes, ma'am. Exactly. The healthcare provider is going to say, okay, so what did you tell the patient to do? And you're going to have to say, hold on, I got to go back. And then that doctor is going to be so upset that you called them without doing something, right? What's wrong with number 1? Why isn't number 1 instruct the client to calm down? It's not therapeutic communication. What does that mean, calm down? I don't know, right? The patient's having anxiety, so when you tell people that are anxious to calm down, what does that make them do? Yeah, they get more anxious. They're like, don't tell me to calm down, right? So we have to instruct the client in slow, deep breathing. Working on a respiratory unit. For patients for a report, who should that nurse see first? Is it number 1, the client with lung disease who has not eaten in 4 days and lost 6 pounds? 2, the client with lung disease who is reporting chest pain, 10 out of 10. 3, client with lung disease who has a pulse ox reading of 89% on 2 liters. Or 4, client with lung disease who is coughing up 3 centimeters blood clots in his sputum. So these questions give students the most trouble on NCLEX because it's not just airway, breathing, circulation, right? Everybody here has an airway problem. Everybody. So now what do we do? So we have to go back to my thinking. Who's the most severe? Who's going to what? Who's going to die first here? What do we think? So let's break it down. The client with lung disease, all right? Everybody has lung disease. So what's going on with this client? They have not eaten in 4 days and lost 6 pounds. So how long, if we're thinking about who's the worst, how long is it going to take this patient to die? A long time, right? Because they are just not eating. So they're just losing weight. What about 2? Client with lung disease who is reporting chest pain, 10 out of 10. What's the problem? Chest pain, right? So if we're talking about airway, breathing, circulation, does this patient have an airway, breathing, or circulation problem right now? Chest pain. Circulation, okay? Pain, circulation. What about 3? They have lung disease, which we know, but they have a pulse ox reading of 89. Is that good or bad? That's kind of bad because they're already on oxygen. So out of airway, breathing, or circulation, what kind of problem is this? Airway, breathing problem, right? The numbers are a little bit low. What do we like to see him at? 95? Yeah. So he's at 89 right now. What about 4? Lung disease. They're coughing up 3-centimeter blood clots. What are we thinking? Airway, breathing, or circulation? Circulation. Okay, they're bleeding. Anytime you have bleeding, that's a circulation problem. So erase your answers and circle the right answer. What's the answer? What's the right answer here? 3. Okay. More practice of these. You'll get better the more you do them. Yeah, you'll get better the more you do them. Okay. All right. Is there one more? Or was that the last one? 3 more. Okay. Let's try another one. Okay, this one right here, you have a patient with a history of CHF. We know CHF now. What's the problem? Patient states they have severe pain when they breathe in and out. What is the most appropriate action by the nurse if your patient says that? Is it number 1, instruct the client to take slow breaths in and out? 2, give the client a pillow for splinting, okay? 3, administer oxygen, or 4, administer prescribed IV pain medication. Okay. All right, I hear different answers, that's okay. Let's just start by what's the issue that the patient is having? They're having what kind of issue? They're having severe pain. So pick the intervention that's going to address that pain. What is it going to be? It's going to be 4. Because everything else that you pick leaves the patient with what? Pain, right? So if you tell the patient to take slow, deep breaths in and out, are they going to be able to do that? No, because they're going to be in what? Pain. And this makes this test so tricky, right? Because we have to get into a place where we understand what our actual priorities are for every situation, all right? And you can do it. 7, let's try it again. One more priority question. Oh, yes, ma'am. Yeah, let's go.
What if their pain is from lack of oxygen to the heart?
Mm-hmm.
Wouldn't it be appropriate to give them oxygen then?
It would be, but does it say that?
No, it just says severe pain.
Mm-hmm. So sometimes as nursing students, we get so deep into the question that we go above, we dig down into it where it's really just wanting to know if we can identify the appropriate treatment based on the current conditions. But when we overstudy or when we know a lot, then we go past what's being asked. And somebody can say, well, this patient has a PE. Maybe they have a PE. But it doesn't say that. It just says they have severe pain. So we need to address that pain. Okay? Good question. Perfect. Okay, priority question here. Very simple. Who should the nurse see first? Let's try it again. Number 1, a client admitted with TB, and they have a what? They have a fever of 102.4. You have 2, a client with SOB when eating. Okay. 3, a client complaining of abdominal pain 7 hours after a PEG tube placement, feeding tube placement. Or 4, a client with decreased pedal pulse, okay, with peripheral artery disease. Well, yeah, what questions do you guys have? She said, I'm still picking number 2. Oh, okay. Let's pass this one. All right. So let's do this one though first. Let's do this one first. If we have this patient let's do this one. Who should the nurse see first here? 3 or 3, I hear 3, 2, 3. Okay. Let's break the patients down so we're on the same page. Person admitted with TB with a fever of 102. What kind of problem is that? Airway, breathing, or circulation? Circulation. 2, a client complaining of what? What's SOB? Shortness of breath when they're doing what? Is that normal? No, that's not normal. So what kind of problem is this? Airway problem, shortness of breath. 3, what kind of problem is abdominal pain? Airway, breathing, circulation. Circulation. And they had it 7 hours after a surgery. So am I shocked that they have abdominal pain? No, this is expected pain, right? 4, what kind of problem is that? Decreased pedal pulse, circulation. So who's our priority here? 2, all right? It would be the same for the one in your book as well, okay? Somebody with an airway problem is always gonna be priority over somebody in pain, okay? Somebody can't breathe, how long do they have to live if you can't breathe? About 6 minutes, right? Somebody that says I have acute abdominal pain, how long can they live? Much longer, okay? So the boards want you to be able to pick those answers and pick them quickly, all right? Any questions about this or the one in your book? No? Okay. All right, and then the last question, I believe it says, can I really pass my nursing exam? Is it yes or no? Yes, you really can. So I want to thank you guys for coming to our class. Was this helpful for you guys? I hope you feel so much better, and I hope you really can see now what it looks like to study in a reasonable, healthy way. All right. Thank you so much. Mark, you want to say anything? Want to say goodbye? I don't even want to see you guys go. I wish I could stay here.
Yeah, we actually live right around the corner.
We
so
do live. We don't live too far away. Y'all can just.
Test 1, 2.
Okay. Okay. All right.
So thank you once again for joining us for Remar Nurse University, Youngstown. This is the end of today's review class, but the purpose and goal of today was to show you exactly what it takes to prepare for NCLEX, to prepare for your entrance exams to get into nursing school, and so that way you approach it with the proper mindset. And not only that, we want to provide everybody with an opportunity to get the full program, whether you're here in person or watching online. If you're not able to get it today, that's okay. You can go to remarnurse.com and get all of your study guides and your materials. Just picture a day when you get your nursing license in the mail. This can happen for you if you've already graduated, if you're ready to test, if you have your ATT. This can happen for you in the next 6 to 8 weeks. Some of you, it's been 2, 3, 4, 5 years. You're struggling with test taking anxiety. You don't know where to start. Some of you begin to doubt yourself, but think about it that by the time Thanksgiving rolls around or just shortly after, what type of Christmas gift would it be for you and your family to be able to celebrate having your LPN or your RN nursing license and just that different change that it makes? And I have to ask you a favor. You ready? I'm gonna ask you a favor. You're watching online. I'm gonna ask you a favor. When you pass NCLEX, not if, but when you pass NCLEX, can we get a video? I'm just, you know what I'm saying? Can we get a video? Can you just, go on FaceTime or something? Tag Regina, say, hey, I did it. I struggled. I prayed. I got the material with God as possible, and that you made it happen. Awesome. And now listen, I'm gonna let you in on a secret, right? Since you guys are from Youngstown area. She didn't tell this part of her story, but Regina, I can't believe I'm saying this. I can't believe I'm saying this, but listen, Regina in high school was a cheerleader. She said that? Oh, sorry. That's just, maybe my mind is just blown. Because when I was in high school, I was, anyway, nobody, you know what I'm saying? I never thought, cheerleaders was over there and praise God. But listen, we're going to lead you all in one quick cheer before we get out of here. You got it?
I got the cheer.
You got the cheer?
I got the cheer,
all
yes.
Right.
You're so... Okay, so the cheer is we can, we will, we must. Can we do that? We can, we will, we must. Pass NCLEX. We can, we will, we must. Pass NCLEX. We can, we will, we must. Pass NCLEX. Good job, guys. Give yourselves a round of applause. You did it.
Give yourselves
today.
a hand.
I'm so proud of you guys. Thank you so much for coming.